Welcome to Vet Candy, where we talk about the hottest vet news. Thanks for joining us today. We are super excited to be here. I'm Dr. Michelle Moyal, an assistant clinical professor here at the College of Veterinary Medicine at Cornell University, and my focus is teaching primary care surgery.
And I'm Patrick Carney. I'm an internist, an epidemiologist, and also an assistant professor here at Cornell. My teaching focus is also on primary care.
And today, we are talking prevention.
One in two dog parks have worms? Interceptor Plus is a monthly chew that protects your dog from not only heartworm disease, but all 5 major worms. Test dogs for heartworm infections prior to use. Reported side effects include vomiting, diarrhea, and lethargy. Interceptor Plus. Ask your vet today.
Today, we are talking prevention. So, Patrick, what does prevention mean to you?
To me, prevention is all of the things we do as veterinarians to promote health rather than to react to health.
That's a great point, Patrick. And could you expand further on that?
So we often think of prevention as the products we use for parasites, ecto and endoparasites, but it's all of the things we do to keep our pets healthy rather than trying to treat illness once it happens. It's a much better approach to keeping our animals healthy.
I 100% agree. And now with the challenges of pandemic, how can we keep that going? So according to a recent survey conducted by the American Pet Products Association, veterinary hospitals are facing unprecedented caseloads these days.
It's been a challenge. We've experienced it here. The American Veterinary Medical Association estimates that veterinary visits went up 3 to 5% in 2020, but efficiency went down by 25%. So there's a perceived and a real increase in veterinary visits and veterinary workload. That's been particularly challenging when you consider some of the stressors that are unique to veterinary medicine.
100%, and I'm sure that that's something we've all felt as we've been in practice. So what do we do to tackle these challenges now?
I think part of it is going to be focusing on ourselves first. It's hard to treat our patients and our clients if we're in a crisis as a community of veterinarians. So veterinarians have almost twice the turnover rate compared to MDs. And veterinary technicians actually have the highest turnover of any healthcare profession.
Incredible. And they're truly our support system here. You know as well as I do, we can't function without our veterinary technicians and our support staff. And I think, your point being well-being is an incredible point. And I think a lot of us are feeling burnt out is a common phrase. And even our students here are feeling it on a daily basis. And so the goal is to try to talk to them about well-being and teach each other that putting yourself first is okay, so we could be there for our patients. So we just touched on the well-being side, which I'm sure we all could benefit from doing some more of. But I guess, how do we tackle the client aspect and the veterinary hospital aspect? I mean, where are these pets coming from?
It's actually a little unclear where they're all coming from. Shelters report that they did not have an increase in available adoptions. They did see faster adoption rates, and they saw that there were fewer relinquishments. So it's maybe that more people are holding on to the animals that they've adopted.
That's really interesting. And I sometimes wonder about some of these, because of what I do, some of these smaller fosters and smaller run groups that maybe even run out of their homes. Maybe those are not counted towards these bigger counts that some are counting. And so I guess the question is, if they're not relinquishing their animals and they've been working remotely, right? Mm-hmm. So they're paying more attention and more in tune with their pets. How do we make sure that those pets get the care they need?
Well, I think a good thing from the pandemic is that over half of people were working from home, and close to 2/3 of them felt that they were better attuned to their animals' health. So that's translated to potentially more veterinary visits, and that in turn is going to result in better wellness for our patients. So I think there is a little bit of a silver lining to the pandemic. The question is going to be what happens when people go back to work. I think we're going to see some real challenges with preventive care when that happens.
I agree, and I think we're starting to see some of that. We're seeing some reports of behavioral issues from some dogs who maybe weren't socialized or, are just used to having people at home all day, and so That's going to be an interesting, that may also increase visits.
I think it probably will. And we've seen that here. We've started to see more separation anxiety cases coming into our community practice clinic. So veterinarians are going to have to brush up on their behavior skills and talk about things like graduated departures and decoupling cues of leaving from actually leaving the house. So some of those things that may have gone by the wayside when we were doing our curbside visits, we probably need to step up again.
Absolutely. And in practice, I was commonly asked if I could just give out a magic medication to help with some of these behavioral issues. So I'm sure it's a struggle for some people going to work, and then it's another struggle to have to tackle a behavioral visit. And now with these caseloads, I'm seeing that, people are coming up to me, and maybe you're seeing the same thing, Patrick, that they just can't get in. They can't get in for a visit to their vet. And so, I think that's a hard challenge for a lot of us to face, trying to fit in all of these appointments.
It's been really tough. I think most veterinarians are definitely people pleasers, and potentially having to postpone care or tell people that we can't book appointments right away has been really, really rough on a lot of veterinarians. We try to keep same-day appointment slots available for our clientele, and we find that they're booking up 2 weeks in advance these days. So we're just having to either double book or in some cases turn people away, which is really tough.
Super heartbreaking. And sending people away where they might have to go into an emergency setting can be costly. And obviously we don't want to do that with our clients. And we know that they trust us. So this is a big issue that we'll need, I think, quite a few. There's not a straightforward answer. I think we're going to need some teamwork on this one. So we just talked about the complicated caseload for both emergency and general practitioners alike. So the question is, what steps do we take to help the clients and our patients? Because I know we want to help them.
Yeah, I think there are several things that we can focus on. We talked about the mental health aspect, and really fostering teamwork within the veterinary practice is going to be beneficial in that respect, and probably help with the drop in efficiency that we saw with the pandemic. So that's a good place to start. Thinking about leveraging technology, so things like online pharmacy could be very, very helpful. And that may help us connect with a clientele that is increasingly more connected and online.
Yes, absolutely. And, I think exploring, and many practices have explored this, telemedicine, right? Telehealth is really big in people. Why shouldn't it be big with animals? Now, we can't do maybe everything a human doctor can do online. I've done some telehealth appointments myself, and I don't see a dog coughing into a screen, but I do think we have some opportunities there, and that could be beneficial for the patient and economical for a veterinary hospital, right?
Sure. The overhead on those telehealth visits is probably substantially less than for an in-person visit. There's a survey out of the United Kingdom showing that about a fifth of pet owners did actually take advantage of telehealth appointments during the pandemic. Wow. So I think there's certainly still room for growth there. And it really provided access to a population that may have otherwise not had access to veterinary care during a trying time.
Absolutely. And I know we're opening our doors more and more, but now, we're kind of filling the backlog of cases that we should have seen or could have seen or really couldn't see during the pandemic. And so I guess the other question is during those visits, how do we make it count, right? So how do we give them everything that they need, because they may not be able to see us again for a little while? It's
tough. We're trying to cram a lot of information into 15 minutes, 30 minutes, however long your appointment slots are. And we know that our clients don't necessarily remember everything we tell them during that appointment. So a lot of it to me is going back to basics, really remembering the fundamentals. Are they getting the vaccines that they need? Are they getting the parasite prevention that they need? Are we addressing those behavioral problems in a proactive manner? So are we talking about separation anxiety for our patients that aren't yet displaying those signs? I think those are all things that we probably should be focusing on.
That is a lot for a 15 to 30 minute appointment. And I'm sure every veterinarian knows that can be really stressful. And so maybe it sounds like we have to figure out ways to communicate with them via email or other ways. Many apps now for veterinary hospitals have text messaging to the hospital. So maybe we kind of need to facilitate that. I agree with you though. Prevention is super important as far as heartworm prevention and GI parasite prevention. And I saw that that a lot of clients who buy 6 months of preventative don't actually return to pick up the other 6 months. And I'm pretty heartbroken by that, because if they break with, parasite infection, some of these guys can become pretty sick, and that worries me as well.
Yeah, and I think going right back to the technology, we can use some of those methods, text messaging, emails, that sort of thing, to just kind of gently nudge our clients. Hey, it's been 6 months. It's time for you to re-up on your heartworm prevention prescription.
Absolutely. A lot of us do try to sell them, a year in one setting, but sometimes it could be, financially restrictive for some clients, and some clients are just not ready to take that big step with a year of prevention, which I understand, and it can be really hard, but I think that's a great idea. And you know what? Education ultimately is what it comes down to in the room, right? How important is it to have these guys on their preventative care? It's so easy now. We have such a plethora of prevention available, right? Like we have chews, we have tablets, and now there's even injections for hormone. There's all these options. So I think that there are definitely options that would work for any owner. We just have to educate them on which one is best for them.
Absolutely. And I'm dating myself a little bit here, but I remember putting powders onto our dog whenever they had a flea infestation. So the abundance, as you said, of really simple, really effective treatments or preventatives for intestinal parasites, heartworm, fleas and ticks really has been kind of I think an undervalued revolution in veterinary medicine. A lot of practice 20 years ago would have been dealing with flea allergy dermatitis, and we so rarely see it these days. So it's really it's both a boon on one side, but it's also potentially making us forget just how important it is.
Absolutely.
So Michelle, we've talked a lot about going back to fundamentals. What are some other key things that we should be emphasizing?
Absolutely. So I know we mentioned flea and tick prevention and heartworm prevention, and a lot of our veterinarians do a great job of talking about that all of the time. But if a client is not established, or a person who is a dog owner or cat owner is not established with a veterinarian, my question is, what resources do they have? And the more I think about it, the more I'm thinking there are opportunities for local clinics for vaccines, right? Where they can get vaccines and sometimes prevention, actually often prevention, and that can be done at a lower cost. And so I think for a large part of the population who may not have access because financially they have no access, that's a really nice resource. The other thing I'm going to want to mention is, the basics of keeping pets lean.
Absolutely.
We want healthy pets, right? So prevention's a part of that, but keeping skinny pets and preventing things like, and again, we all talk about it, diabetes, which I'm sure this guy knows about, right? Orthopedic diseases. And so that just kind of makes our job much tougher, especially later in our patient's life. So we're going to get to that. We have to talk about grooming needs. I think some of us think that when an owner comes to us with a dog that maybe has some longer hair, that we assume that they know what kind of grooming needs they have, but sometimes they just may not know, right? And that's part of their overall health. And again, because a lot of these pets have been at home with their owners, their exercise needs may or may not have been met, right?
That is true.
And so if an owner was, working remotely, maybe they had the time to take some hikes, take some opportunities. I say that, but I was binging Netflix. But maybe maybe now they're returning back to work and those exercise needs are not being met. And that kind of leads to a dog that gains weight, and then maybe some of the behavioral issues we were talking about.
Absolutely. I think the emphasis on weight is really important. We know that weight certainly increases longevity in dogs and probably in cats as well.
Absolutely.
The grooming is a really good point, and one that I think a lot of veterinarians may not immediately think of. I had a client just the past week that told me she couldn't get into an area groomer anywhere. They were booking out the same way veterinary clinics are. And then we had a cat yesterday that actually could not urinate because he had a mat over his prepuce. So it seems like something simple. Sometimes we kind of put that outside of the veterinary realm, but it can be really important for their health as well.
Absolutely. And I'm sure you've been in that position. I've been in that position where we're shaving animals and we're like, listen, guys, we're not groomers, but here's what we can offer. And so now we're using our technician time to groom animals. And so it could be really hard. And obviously that makes it tougher to see the rest of our patients.
Absolutely. I like the emphasis on using our resources and our people wisely. That drop in efficiency, we need to kind of claw that back by making sure that they can see groomers in a timely fashion.
Yes. And the other thing I want to make sure when we're talking about fundamentals is something that I talk to our students about. And that's the importance of, and I'm not plugging any specific company, pet insurance. Now, everybody may have different views on this, but sometimes it's a nice option for a pet owner if they need to get into, a hospital right away for something more emergent when their veterinarian maybe just is at capacity, maybe just doesn't have the capacity to take them that day.
Right. I think pet insurance is certainly underutilized in the United States. In Europe, it's got really wide uptake, which is nice. Very few animals in the United States still have pet insurance, and it can absolutely be a life-saving thing. So for, in most cases, a relatively modest price, you can afford that GDV surgery. But we need to do a better job of communicating that to our clients. So if you see that German Shepherd, have that discussion about Pexy, and if they're not Pexying, make sure they know about GDV and have them buy that insurance policy.
Absolutely. Absolutely. I think it's worth it to take a few extra seconds to educate them. I know it's not easy. And again, if doctors are busy in between appointments, maybe they utilize another person on their staff to also try to get that message across about pet insurance. But that's not easy.
It can be a challenge, but I think a lot of practices do a good job of having a technician or a client services representative and designating them as the pet insurance person. They're the one that you go to if you've got questions. So delegating and making sure that you give people the latitude to become an authority in these topics can be very good for getting some of that efficiency.
I love that. And, at a practice I was at previously, we actually had a CSR who was very familiar with pet insurance, had an unfortunate issue with her own pet that required extensive surgical intervention. And so she was the best person to promote pet insurance because she believed in it, because she needed it and used it herself.
Right.
And so I definitely think that that's a great thing to think about.
What would you think about advertising materials in the clinic? Kind of here's a case that benefited from having access to insurance, and maybe it made the difference in that patient.
I love that. I think it's a little bit hard, as a veterinarian, I try not to promote one pet insurance over another because every client has different needs, but I like offering a few, and I encourage clients to Google or go online, talk to their friends, and, really do some research to see what is best for their specific pet and their specific lifestyle, right? But absolutely, I would totally do that. Plus, they're cute brochures.
True.
So Patrick, a lot of the things we spoke about really aren't new to veterinarians, and veterinarians are definitely overwhelmed running case to case, appointment to appointment. I mean, some of them are not eating, they're not using their restroom, they're not drinking water. And so it's so incredibly difficult, but I hope that if we return to these fundamentals, we'll be able to give a lot of information in one visit so an owner and their pet feels great and they don't necessarily have to come right back if something arises.
Yeah, I think that's really important to keep our minds on. So that wraps things up for this episode of Vet Candy.
I'm Michelle Moyal.
And I'm Patrick Carney. Thanks so much for joining us.
Not all preventatives protect your dog from heartworm disease and all 5 major worms, leaving a gap in their coverage. Close the gap with Interceptor Plus. Test dogs for heartworm infections prior to use. Reported side effects include vomiting, diarrhea, and lethargy. Interceptor Plus. Ask your vet today.
Hi, I'm Shannon Gregoire, and welcome to Vet Candy, the destination for everything vet med. Launched in 2019, Vet Candy has grown from a weekly email newsletter into a modern veterinary lifestyle brand and an indispensable resource for the best veterinary education. Let me show you around our website, myvetcandy.com, and show you how to keep up with everything vet med. First, let's check out our homepage. We have some great stories to keep you up to date on the latest clinical updates, scientific news, and expert lifestyle tips. We also celebrate amazing people who are making our world a better place. This is my favorite part. For those of you that are looking for exciting veterinary CE, look no further. We have some great stuff for you, and I promise, no PowerPoints and no webinars because we do things differently. Maybe that's why we have more than 1 million views. Now let's go to CE On Demand. Here you will find videos that are all race, New York State, and CPD approved for veterinary education credits. Vet Candy is the streaming platform where veterinary professionals can learn from the world's most exciting experts and top influencers. Stream anywhere, anytime, and at your own pace. What I love most is that our videos are studio quality, shot and edited in 4K so you can stream them in 1080p. And best of all, Vet Candy's entire collection of more than 75 continuing education videos can be streamed anywhere, anytime, for free. And you can also select up to 12 different languages to watch them by selecting the language of your choice in the subtitles. So, how do you get your CE credit after watching an eligible video? It's simple. All you need to do is watch the video and then pass the quiz. Click on the Take Quiz button. This is the button below the video that takes you to an online test. When you pass the quiz, you will instantly receive an email with a PDF with your certificate of completion. It really is that easy. Next, we have a variety of Vet Candy original shows, from talk shows to rounds and games. There's something for everyone, and we are committed to bringing in diverse voices and unique perspectives. Let's look at our master courses. We have 4 master courses right now, and more are coming soon. We have ophthalmology, which is taught by veterinary ophthalmologist Dr. DJ Heusler, toxicology, taught by criticalist Dr. Carrie Hemmelgarn, surgery, taught by board-certified veterinary surgeon Dr. Philippa Pavia, and respiratory disease, which is taught by Dr. Anthony Gonzalez. For our master courses, there are 8 modules for each course. Watch each module and then click on the link that says Take Quiz, and it will take you to an online quiz. When you pass the quiz, you will receive your certificate of completion of the course, plus a link to download some tools to help you celebrate and share your accomplishments. You just click on that link and it takes you to the tools. Next, let's look at Vet Candy Magazine. Vet Candy Magazine is a monthly publication for veterinary professionals. From the latest clinical updates to expert advice and so much more. And of course, our cover models are the most incredible and inspiring professionals on the planet. You can check out our magazines here on our website, or you can get them for free on Audible, Kindle, and Apple Books. Next, we have our podcasts. What I love most about our podcasts is that I can listen to them while I'm driving to work, on a jog, or even working out. And we have so many podcasts that you can listen to. Living Well with Dr. Jessica Turner is a show all about wellness and recovery. Her guests span from well-being experts to real-life veterinarians who share their struggles and challenges. Do you like comedy? Then you will love Desk Wench Confessions with comedian turned vet receptionist Caitlin Palmer. One of my favorite parts of her show is when she and her guests read revenge reviews and decipher what truly happened. Oh, and once in a while, Caitlin does break into song and even gets her guests to sing along. Vet Candy Rounds with the Hollies is all about rounds. We take you back to vet school with a mystery case and a special expert host to tell us the story. These shows are fun, and what happens at the end is always a surprise. Vet Candy IRL, hosted by yours truly, as well as Tatiana Rogers, a vet student from Colorado State, and Lexi Rodriguez, a Texas A&M vet student. Vet Candy IRL celebrates inspirational role models and focuses on empowerment and equality, including disruptive leaders who have broken boundaries to get where they are today. Vet Candy Life, hosted by veterinarian Dr. Quincy Hawley and veterinary technician Renee Michelle, is a show that focuses on physical and emotional wellness for veterinary professionals and students. We know that veterinary medicine is a stressful profession, and veterinarians experience a high rate of burnout and compassion fatigue. Each episode of Vet Candy Life features expert tips, lifestyle advice, and real-life experiences from the most exciting veterinary professionals in our industry. Vet Candy books are great resources. We have a selection that are RACE, New York State, and CPD approved for veterinary continuing education on a variety of topics from marketing to CBD. For CE credit, you read the book and then take the quiz. Click on the button that says Take Quiz. Pass the quiz on the online quiz site, and then you will instantly receive an email with your certificate of completion. You can check out our books for free on Audible, Kindle, and Apple Books. New for 2022, we created a page just for students to help them prepare for NAVLE in real life. On this page, you will see a variety of videos, books, and podcasts curated for students to make learning fun. We also have some great advice from Dr. Becky Lossing of Mini Mammoth, who helps make studying easier with time management tips. Vet Candy also created 2 digital books to prepare for the test: Vet Candy Prep, Cat Diseases You Need to Know, and Vet Candy Prep, Dog Diseases You Need to Know, each with a link to a quiz to test your knowledge. Want to stay up to date with everything vet med? Then you definitely want to subscribe to Vet Candy. We keep our tens of thousands of subscribers up to date on product recommendations, special offers, and clinical updates. To subscribe, you just click here and enter your email. So that's it for the tour of Vet Candy. I hope you enjoyed it, and thank you for watching.